Okay, welcome everybody to the SRC-Salus. I will ask you right now, please, to kindly disable your phones. This is going to be televised broadcast for everybody in the desks at the UN to hear your comments, and we're going to keep it in the archives for 1 year. Therefore, people can refer to everything that you said and the questions that we ask, that they can use them as a guide. And we are very honored to have dignitaries of this kind of the hospitals for wellness for everybody. It is an honor and a pleasure, and it is amazing that you are here today. It is a service for humanity, for all of our guests. I believe totally that being here and being present is what's going to make a difference to the world. So I welcome you all, and I thank you for coming. And we're going to be starting shortly as soon as they give us the signs. They're testing the microphones. I'm going to start with an introduction myself for 1 minute, then you take over and you introduce everybody. You can give us the sign when we're on.
Just give me the cue.
Yeah, we need the cue. These microphones will pop as we're talking. You just touch the microphone and then they light up.
So every time you speak, gentlemen, you'll see red.
Yanna, did you talk to Dr. Mango? You know how to
Dr.
say?
Mango, how do you do?
How's it going?
I'm so sorry.
Yeah.
Okay.
Yes, because he's going to be talking about
What did we speak about?
stress and body management.
Very
Yeah.
good. Let me just, Mango, Dr. Mango.
Yeah.
Christopher Mango.
Let me write that down. Dr. Mango will be coming to you after Dr. After actually Ryan.
Yeah.
Perry, once Ethan, are you going to be sitting there? Oh, you will be there. Okay. Do you mind if you switch? Do you mind if you switch with Mr. Hopkins? Awesome. Only because I need him in the line.
That's cool. And then anybody that has any presentations can just plug into the AC.
Beautiful. Anyone who has a presentation, you're very welcome to give it to Ethan. Who's already done it? So after Ryan, after we speak about nutrition and all the ailments, then we'll be going to speak to you. Dr. Mango, give me the background if you have a moment. Are you a doctor?
Yeah.
Doctor,
Yeah. You need a like in case you
I'm sorry, I don't have a They'll be like, Ryan, stop it, enough. Ryan, I'm not, am I, are you a doctor of? Just You know what? It's just
What's happening right now? Hi, my name's Julian Michael, and I'm a alternative therapist, hypnotherapist, past life regressionist for 30 years, and a numerologist for close to 40 years. And numerology is a science. The father of mathematics is a man called Pythagoras, and he said everything in the universe is number, that number has a meaning. So we are walking, talking bits of information of our evolution. And I ask people, what if? What if we've been here before? What if we are in a certain state of consciousness and evolution in our lives? So we have numbers. Those numbers correspond to a language, and this language is called the science of numerology. So let's take, right now, because we don't have that much time, let's take 2017. That's what we're in right now. So we add 2017, which comes out to a 10. 1 and 0 is 1. So we're in a 1 universal year of this 10. And the 1 is all about new beginnings. It's all about rebooting ourselves in this new epoch of time that's taking place, for us to understand ourselves on a deeper level of not only who we are, but why are we here at this time of the great changes that are taking place. So 2017 is a 2, which is all about sharing. The 1 is the self. The 7, which is the end of 2017, and this is a very interesting vibration. The 7 is, and if you look at its form, it's a parabolic antenna that faces the earth. So what this 7 is actually doing is taking all the information, nutrients out of Mother Earth, and it's sending this information as an arrow out to the stars, to the heavens, and beyond. So what this 7 is asking us to do as a consciousness at this time of Mother Earth is to understand this sacredness of this vibration of 7, which is also dealing with the 7 musical notes, the 7 colors of the rainbow, as well as something called the 7 chakras, which balance our physical, mental, emotional, and spiritual selves within ourselves. This is a Hindu, Indian philosophy. So the 7, being this sacred vibration, is asking us to be more in touch with the mysteries of who we are, why we're here, what we're doing, and at the same time also being more mindful of not only ourselves and our bodies, our minds and spirits, but understanding more of what makes us tick, of what makes us get up in the morning and all of a sudden say, wow, okay, let's go and do this particular job, let's go and feed the kids, let me get myself together and ready for whatever it is that I'm doing. What is it that gets you up? What practice, if anything, helps you to understand at this time of this great change that's taking place, to align yourself? Because this is a time of the one. 2017 is that 10-1. And the one is all about being one. Here I am, and I'm a one. So I'm here to also understand that what am I here more to pioneer, to discover? What am I here more to understand more about the adventure, the spirit that is part of me? So be flexible and free at this time and understand that we're all miracles here to create miracles. Thank you. Blessings.
Good afternoon, everybody. I'm Yanna Darilis-Gianna, the president of the SRC-Salus Wellbeing Network. I welcome you all. The purpose of our club is to invite everybody to join in health, in wellness, from mind, body, and spirit. Today, we have the distinguished pleasure of having these wonderful, wonderful speakers that are going to share their expertise and their knowledge with us. And this club is open to the public of the United Nations. It's under the Recreation Council for the staff, so you're all welcome to be a member, and you're welcome to join us. And we have Tina, our secretary from the Recreation Council, with us. They will assist you in all of these wonderful things. Thank you, Tina, for all the bookings and all the rooms. We also have Augustin Scaria, who's provided us with the rooms all the time, and also making all of the arrangements for the meetings. And our public relations, Alvaro Calderon, who supported the club and helped us. He is also the Recreation Council treasurer. And we have our new treasurer, Tony Wilson. And we have a new committee with lots of wonderful members. Ethan is our designer. Baja is our representative, and Greg is going to be our assistant event planner. So we're going to have a lot of things happening. So thank you very much for coming, and welcome Yanna Darilis. She's been with us in many panels, so we thank you for organizing this today. Thank you. God bless you.
Ladies and gentlemen, welcome to the Men's Health Panel here at the United Nations Recreational Staff Council Salus Wellness Network. The Salus Wellness Network is focused on raising awareness about health of our planet and our society. We would like to thank the president of the Salus Wellness Network, Susana Bastarica, her board, and her staff for all their efforts to make these events possible. Today's topic is one of many to follow. We are focusing on men's health. As September is Prostate Cancer Month, we believe that despite past focus on women's health, men's health has taken the lead. Recent studies show that on average, women outlive men by 5 years. Out of the 15 leading deaths in men and women, men lead women in all of them except Alzheimer's disease. The risk factors that men need to be aware of and that will be discussed today include cardiovascular disease, prostate cancer, lung cancer is rated higher than skin cancer amongst men. Rising rates in suicide, that many men suffer from depression, and suicide is the 8th leading cause of death in men. Diabetes, there's a rise in blood sugar levels from diet and stress. Erectile dysfunction, 39% of men 40 years and over have a problem with erectile dysfunction. 1 in 5 men die from cardiovascular disease. 1 in 6 men are diagnosed with prostate cancer. We also need to raise more awareness on HIV and AIDS, of which the GBM community is at high risk for. Our distinguished panel of guests today will enlighten us about these topics with their expertise. Ladies and gentlemen, let's please welcome, and without any lineup, Dr. David Samadi, Dr. Konstantin Plestis, Dr. Paretsky, Dr. Perry Halkitis, Ryan Turner, and Dr. Mango. We will be beginning with Dr. Konstantin Plestis, a Systems Chief of Cardiothoracic and Vascular Surgery at Lankinu Heart Institute, part of Mainline Health. Cardiovascular disease is the first, and strokes are the second leading causes of death worldwide in both men and women. It is a topic of global concern. Dr. Plestis, can you please explain to us why men are facing this high risk factor in such an advanced technological age? Where is all this stemming from?
So to start with, I would like to thank Susanna for this wonderful panel that you have put together, and of course the United Nations for taking the initiative to bring the important topic of man's health to the community. Now, there's no question that men, and Yanna, I would like to thank you for kindly inviting me to that. And I'm very glad to be part of that panel. Now, men are affected by heart disease very frequently. And it is a multifactorial issue with the men. Of course, there's a genetic predisposition like everything else in life, but also there are factors, as we know, like high blood pressure, diabetes, and I'm sure you're going to talk about that in the future, hypertension, hypercholesterolemia, and that they have to do with the way that we live in a daily life. Stress is an important part of that too. So all these factors cumulatively have an impact in health, and they definitely have a significant impact in the cardiovascular disease, and men are affected tremendously by that.
Dr. Plessis, what is some information you can offer our audience? Give us a little bit of a checklist for men as far as cardiovascular health is concerned.
So, like everything else, as I said, a strong family history is an indication that something may be going wrong with us, because cardiovascular disease can be affected genetically. And if they are members of a family that they have heart disease, then there has to be an expectation that their brothers and sisters, their sons and daughters, may be affected by that disease. And that requires obviously screening even at a younger age for this type of patients. But again, there are factors that they are influenced by the environment. The way that we live, high blood pressure is a very important factor in cardiovascular disease, smoking, diabetes, and weight. I'm just giving you a few of the factors that they are very well known that they can affect the manifestation of coronary artery disease in men, and in everybody, but in particular in men. And quite often, manipulation of those factors may help these people to live better quality of life and longer lives.
Dr. Plessis, we've been seeing men suffering from strokes and heart attacks at a younger age. It used to be that men didn't have to worry about this until much later on for some reason. But now we're seeing it's more prevalent in younger ages. Can you give us a little bit of information? Why is this occurring?
I think that, as I said, besides the genetics, the environment plays a role in the way that the disease, in the time that the disease is manifested. For example, if you live a very stressful life, if the weight is more than it should be, if you are a smoker, all these add up in the substrate. And obviously, in stress, as I said, is also a very important thing. We see, you're absolutely correct, we see young individuals that they are affected by heart attack. Like a year ago, I had to take care of a 32-year-old woman. She was a coach, she was playing soccer, and she almost dropped dead. They revived her in the scene, and she had occlusion of the coronary arteries. That was not very common in the past, but we see it more and more frequently. And again, as I said, it has to do with the influence of the way of life, the way that we live, as well as all the other factors. They are working together to express the disease at the younger and younger ages. And that, if I make a statement, people don't expect that. And they don't take precautions for that, because you don't expect a 40-year-old person or a 50-year-old person to be affected by that disease. And this is where prevention can be a very important part to avert the consequences of a heart attack or a stroke or all the consequences of atherosclerosis.
What are some symptoms rather, that if somebody is feeling they should give attention to? Because men, for some reason, they're always saying, oh, I'm fine. They're in denial that something might be wrong. It may be part of their masculinity. Can you help us, give us some information for all the men that are watching, that if they feel certain things, when is it that they need to ring that little bell in their head that they might have to have an appointment with you or with a cardiovascular surgeon?
You are absolutely correct. I think men in general, including myself, okay, and I'm a heart surgeon, so I deal with that every day. We are notorious of not taking care of ourselves. And I think it's an inherent defense mechanism against the feeling that something will happen to us. And the symptoms quite often are prominent, meaning that somebody may have chest pain or pain radiating to the back, but quite often the symptoms are not as specific. For example, I take care of a lot of patients that they complain of shortness of breath at a younger age. They go upstairs, they feel short of breath, they don't feel as good as the year before, the strength is not as good, they don't feel as vibrant. All these non-specific symptoms, particularly in people that they have a history of disease, they have to be taken into consideration. And I have to say that this is where it is important that people may have a primary care physician, because the interpretation of the symptoms may require a physician to be able to do the accurate diagnosis, because sometimes the symptoms may not be very specific. So having a primary care physician, having a stress test in your 50s, getting a prostate evaluation, check your diabetes, all these are factors that if you have a good primary care doctor, may be able to go through and find out which of these symptoms may be important and which may not be important for that particular patient, because the symptoms may not be very specific.
We're going to come back to Dr. Plessis. Thank you so much. We're going to be passing on to Dr. Samadi, Chairman of Urology and Chief of Robotic Surgery at Lenox Hill Hospital. He's a board-certified urologist specializing in the diagnosis and treatment of urological diseases, prostate cancer, kidney cancer, and bladder cancer, and specializes in advanced minimal invasive treatments for prostate cancer, including laparoscopic, radical prostatectomy and laparoscopic robotic radical prostatectomy. He was also, very important, the co-host of Fox News' House Call for 6 years. Thank you for joining us, Dr. Stamati. Prostate cancer, it is Prostate Cancer Month. It is the most common cancer in men other than skin cancer. Statistics are showing that 1 in 6 men will be diagnosed with prostate cancer in his lifetime. But thank God to modern medicine, only 1 in 35 will die from it. Fewer men than ever are dying from lung cancer because of the decline in smoking. However, smoking is still causing around 90% of all lung cancer. What can someone do to be able to prevent cancer? What is the checklist, the annual checklist for men? What is it that they should be aware of? Enlighten us a little bit more about your field.
Yeah, Yanna, thank you very much. It's a pleasure and honor to be here. And Susanna, thank you for setting this up. And to all the audience who's listening to this, I was coming to UN not knowing that we were going to have a men's health seminar. This is a huge, huge surprise to have this in 2017. As you know, it's always been about women, and there's absolutely nothing wrong with that. I think October and breast cancer awareness is absolutely important. If you look at the statistics of prostate cancer and breast cancer, these two diseases are exactly like brother and sisters. Look at the numbers of breast cancer versus prostate cancer. 230,000 nationally on both sides, 1 out of 6 men, 1 out of 7 women. About 30,000 on both sides die, except women's health gets all the attention in the world. And you see football players, firefighters wear pink. And if I ask anybody around the room, say September, did you know that September is Prostate Cancer Month? They may not know, or they may not even know that blue is the color for prostate cancer. So I appreciate you setting this up. I think this is a great initiative, and I think we should have it every year.
More marketing for men's prostate cancer.
100%. Prostate cancer is a silent killer. 1 out of 6 men in this room may have prostate cancer, and they may not be aware of this. By the time it becomes symptomatic, it's already too late. If you wake up with a back pain and the cancer is already spread, it's pretty much done. And that happens despite the fact that media and a lot of news broadcasts out there keep saying that it's a slow-growing disease, we don't need to screen, and this last 5-10 years or so, they have not done any service by confusing men out there. You asked about what men should be doing. If you're around early 40-year-old, you should be getting a baseline PSA. Is PSA the best test that we have? Is it sensitive? Absolutely not. But that's the only test that we have. And there's an art to really following PSA. It could be confusing. That's why we have experts in prostate cancer. And it's important to see a good urologist who is expert in this. Get your exam, possibly genetic testings. There are many urine tests and MRIs that now we have that we didn't have 5 years ago. When prostate cancer is detected early, the cure rate and survival rate is tremendously successful. Over 90% of patients are really doing well. oh my God, I'm worried about my sexual function and urinary control, right? That's what you would ask. Well, that's where the experience and expertise comes. The more you do, the better it is, and that's why we need people in the field who do a lot of them. Obviously, in the field of robotic surgery, that's what I do for my patients. We've done about 7,000 of these cases, and they do really, really well, some tough cases, etc. What men need to know is in their early 20s, you need to be doing testicular exams. You need to be checking your cholesterol level. You need to make sure you understand about your thyroid, because when you catch all of these, and screening is extremely vital, is very important. We have a problem in this country because we have 30% of the country is suffering from obesity and diabetes. And what has happened is we have set a great example for our children, and childhood obesity is on the rise as well. And that's a huge problem. What's going to happen is that all of this generation is going to turn out on Dr. Dino's table for cardiac bypass and for coronary artery disease and stroke and heart disease and what we call metabolic syndrome. We don't want to have that happen, and that's the reason why we're here. So what you do is you educate men out there that we are also very vulnerable. And it's true, as Yanna mentioned and as Dino mentioned, we men, we think we're a completely different species, that nothing bad happens to us. We also don't like to go see doctors, because if it's not broken, why fix it? If the car is running well, who the hell wants to go and fix the car? That's the way men are. But women are very smart, and I give them credit, because they go for pap smear, they go for colonoscopy, they go for their mammograms, and that's why they outlive men. It's not that women kill us from arguments. It's the fact that they go for prevention and screening. So I thought I could get a laugh at that. So the bottom line is you need to know that, especially not only for prostate cancer, which is coming in September, go out there, find out what your risks are. We talk about family history. We talk about the environment. We talk about diet. Are you getting up and exercising 3 times a week? Are you watching what you're eating, etc.? And all of that plays a big role in what you do. So early 20s and 30s, testicular exam is a big deal. You get to your 40s and 50s, it's all about prostate. 50s and 60s, it's all about colonoscopy and colon cancer. And when we get to 60s and 70s, it's all about brain and stress management. But what we do in 20s and 30s and 40s is an example of what is going to happen to us in your 60s and 70s. Now, Dino has done, and a lot of cardiac surgeons and cardiologists have done a great job. What was the leading cause of death among men across the board? Heart disease. Because of the prevention that they have done, and cholesterol medications, and diet change, and the surgeries and cardiac stent that they do, now men are going to their 80s and 90s, and they're living long. When you live long, what's going to happen? You're going to have prostate cancer. You're going to have enlarged prostate. You're going to have erectile dysfunctions. And all of these have solutions to that, and I'm happy to discuss further with you.
Dr. Samadi, men believe that, being diagnosed with cancer means that they have to suffer. Let us know what modern medicine is offering to help save these lives and also help make their quality of life.
I think in general, that's a
to sustain the quality of life.
Absolutely. I think it's very important for people to know that knowing your labs and knowing your tests and that information and data is very, very powerful. The problem with us, including myself, is that we're scared. We're scared of that. And if you know about this, then you got to do something, and that can affect your quality of life. Doesn't have to be like this. So whether it's knowing your cholesterol level or knowing your blood pressure level to prevent stroke, whether it's your PSA level, and not just the lab test. You never act based on one PSA level. You look at the trend and velocity. If you know this data, Yanna, you can really prevent, and there are solutions to it. With robotic surgery, we have developed a tremendous technique out there called SMART technique. We used to move and do the nerve sparing by moving the nerves away from the prostate. We had years ago incontinence and impotence. Today, with the technology of robotic surgery in our hands, at least in New York City and many other doctors, we're able to move the prostate away from the surrounding nerves and leave everything intact. And we'll see about 75% of men out there are enjoying and great sex life. And sex is a huge part of life as far as you're boosting your immune system, longevity, lowering your stress, and so on and so forth. And you know what? There are very few men that have incontinence. That's pretty much resolved, and we see people after surgery, they're doing very well. And the reason why surgery happens to be a gold standard is because surgery gives you a very accurate stage. Your PSA after surgery should be undetectable and 0. You can give radiation after surgery, but with all these ads that we hear on radio about CyberKnife and radiation, once you start radiation and the cancer returns after radiation, surgery is not a good option. So then you're burning bridges. So you have to be very careful what treatment you choose for your prostate cancer, and don't be afraid. Just look for that expert surgeon who's going to get you through this tough time.
Dr. Samadi, I don't know if you can answer this question, but with, in the 21st century, with so much cancer research, why is it that cancer is still rising?
I think that, the answer is not clear, but I think we mentioned stress, and I hope we hear a little bit about stress. I have said before, and I hope I'm not causing a huge problem in the UN, I think our food chain system is contaminated. I think, it's interesting because I think when you live in a lot of European countries and other countries, and unfortunately Europe and Middle East is catching up with us. And here we are in UN, and you see a lot of people that have migrated from Japan where they didn't have cancer, they move over here with our fast food lifestyle, lack of sleep. We got to talk about lack of sleep. We have become these robots that are constantly running. We've become like these rats in a lab that constantly are running and really without stop and not knowing where we're going. So what happens? You don't digest your food. You're eating it fast. You're eating low quality food. You know what they did? It's very interesting. They kept saying, these guys, they kept saying like cholesterol is not good for you. Cholesterol is going to kill you because it causes coronary artery disease. So the food system, they decided, okay, the word is out. We've got to do something about it. Let's get cholesterol out of our food system. So what happens when you take cholesterol out of food? It becomes like a cardboard. It's like a sandpaper. It tastes like ridiculously like garbage. So what do? We're going to add hidden sugar. That high fructose corn syrup is what's killing us. And that's hidden in your burgers, in your bread, in everything that you're eating. Where is it going? It's becoming a belly fat. What does belly fat do to you? Belly fat is the reason why there are all these hormonal changes, toxins in our body, and clogging the arteries. And of course, in urology, when we talk about man boobs, and the guy says, how come like my sexual function is not working? Your testosterone is getting converted to estrogen, and your libido goes down, and that's the end of it. So it's a complicated situation here.
Thank you, Dr. Samadi. We'll come back to you.
Thank
We're just
you.
going to pass it on to Dr. Leonid Paretsky, the Chief Division of Endocrinology, Associate Chairman of Research, and Director of the Gerald Friedman Diabetes Institute. All of these are the departments of medicine at Lenox Hill Hospital, New York. He is also the professor of medicine at Hofstra Northwell School of Medicine and Feinstein Institute for Medical Research. Dr. Paretsky, thank you for joining us. We'll be discussing obesity, diabetes mellitus, and hypogonadism are endocrinological threats to men's health in the 21st century. Please give us some information about the rise in obesity, hormonal imbalance, and the rise of diabetes amongst men, and what men are predisposed to when they are diagnosed with these health problems, rather.
This one? Yeah. Thank you very much, Yanna and Susanna, for inviting me. It's a little hard to follow a former TV host, but I'll try to do my
We
best.
have a little time, but we're going to try and cover as much as we can in the most simplest way for our viewers.
I prepared some slides. I don't know if they can be shown now, at least for the audience here. Can you? I think you have it. But I can start. Yes, I can start.
Just following what Dr. Plessis and Dr. Samadi said, just to echo the message of there are hormonal imbalances, there are thyroid problems amongst men. This is a rise, there's lower testosterone levels. Please enlighten us on why this is happening.
So I entitled my very brief talk, Endocrinological Threats to Men in the 21st Century. But before I go into that, I thought I would say a word or two about what endocrinology is, because at various parties, when I'm asked what kind of medicine you practice, and I say endocrinology, like, well, what is that? Well, endocrinology is a science about hormones. It comes from Latin, endos, which means internal, krinos, secrete. So it's a science about internal secretions, which are hormones. I want to thank Nilsson Tapia, who is here behind me, for helping me set up the slides. And we can move to the next slide. That's the explanation of what endocrinology is. So hormones interact with these molecules called receptors on the cell surface all over the body. And this interaction is important because if you have a lot of hormone around, like we have in diabetes, a lot of insulin actually is present, but it doesn't interact properly with the receptor, the hormone is inactive. And we'll get back to that in a little while. Next, please. So threat number one, obesity. These are the numbers. And you can see how obesity, this is global obesity prevalence, has grown tremendously over time. This is comparing 1975 to 2014. Now the next slide, if we can show, shows where obesity will be in 2025. Now in the United States today, as it was mentioned before, about 1/3 of the country is obese already, about 30%. And 60% are either obese or overweight. So 2/3 of the adult population are. And this is growing also in the countries of developing world, as you can see, for example, in China and India. Next, please. So why is obesity so common? What kind of disease affects 60% of the population, except for maybe plague, like medieval infections? It turns out that the genes that cause obesity today are life-saving genes when you live in an environment that is very different from ours. As you can imagine, most animals run around all day looking for food. They don't have 3 meals delivered to them as they sit at the computer. And once they get the meal, they have to be able to store the energy because the next meal may not be coming for a few days. So obviously, individuals who are able to do that are those who survive. We still have those genes, and we know a lot of them now, except, we sit in rooms like this and eat 3 times a day. I don't know where it ever came from, 3 meals a day, but that's what we do.
So you're saying, doctor, that the human body is not designed to eat 3 meals a day?
The human body is designed to store energy, or any mammalian body, actually, any animal. So if more energy is coming than you are using, you will store it as fat. And this is a life-saving function. And that's why in the current environment, we're all essentially becoming obese. This is also why it's so hard to treat obesity. We'll get to that into that a little bit later, because you're really fighting the biology, the genes that are very well established and preserved through evolution. Now, next slide. There was some talk about environment in terms of environmental pollution. Less is known about that than about genetics of obesity, actually, but there is a little bit of knowledge. For example, BPA, bisphenol A, which is in all plastic containers that children drink out of and adults, and also in cans and everything else, has been shown in animals to be what we call an obesogen. It can produce obesity in animals. Whether that's happening in humans, it's a little hard to say, but certainly at least the animal evidence is there. Next. So why is obesity bad? Who cares if we're all obese? Maybe it's not so bad. In fact, sometimes it could be life-saving. But as it was mentioned, obesity is the leading cause of cardiovascular disease, arthritis, certain kinds of cancer, hypogonadism, and also diabetes. So if we can move to the threat number 2 now, which is on the next slide, and that's diabetes. So epidemic of diabetes, of type 2 diabetes, closely follows epidemic of obesity. Obesity is the major number 1 risk factor for diabetes. And as you can see here, at the moment, there are numbers there for 2015, but in 2017, about 470 million people in the world have diabetes. In the United States, about close to 10% of population has diabetes. Next. How does obesity lead to diabetes? We're not absolutely sure, but there are these substances that are made by fat tissue that interfere with the interaction of insulin with its receptor, something I showed at the first slide. So most people with diabetes have no problem producing insulin to control their blood sugar, but this insulin isn't really working because of the state of insulin resistance, which is developed because of obesity. Next. Why is diabetes bad? Well, it is probably a lot of your patients have diabetes. It is the leading cause of cardiovascular disease. It is the leading cause of kidney failure, leading cause of blindness in the developed world, and leading cause of amputations in peacetime, and also a leading cause of erectile dysfunction, as was mentioned before. Next. Threat number 3, again, was mentioned previously, and it's interesting, we really didn't talk to each other, honestly, before this, but all of us are coming to basically the same problems. So hypo means low, gonad is a reproductive organ, in men that's testis, and hypogonadism is a state of inadequate function of testes in men. Why is that happening? And the leading cause is obesity, and again, it was mentioned very briefly, but I may spend a second on this. Next slide. This is, simply showing that as you become more obese, the hypogonadism prevalence is increasing dramatically. Next. Promise, one slide on biochemistry, and some of it was you were already prepared. But you may or may not be surprised that all estrogens in men and in women actually are derived from androgens. So all estradiol in men and women is made out of testosterone by this enzyme called aromatase. Now, where is aromatase present in the human body? In fat tissue. So as you accumulate more fat, if you're a man, you are beginning to deplete your testosterone level through this process called substrate depletion, but something else is at play. Next slide, please. This may be a little hard to understand, but basically, as you convert testosterone to estrogen, estrogen begins to inhibit your pituitary, which is needed to stimulate testosterone production in your testes. So you develop this vicious cycle where you're attacking testosterone in 2 ways. You're depleting it through aromatization and also reducing its production because of inhibition of pituitary. And that's why hypogonadism is so prevalent today in obese men. I think I'm almost finished. A couple more slides and we'll be done. Next. Why is this bad? It leads to depression, reduced muscle mass, erectile dysfunction, fatigue, and problems with libido, which of course affect erectile function as well. Next. So what can be done? As was mentioned before, all of these problems are really linked to obesity. We really need to prevent obesity by managing it with education, lifestyle interventions, about which I think we'll be talking about diet later, and surgical interventions. And can we look at the next slide, if it is here? And there is, I didn't want to make it all so bleak, you know. So there is actually a lot of improvement in the last 20 years, 2 decades, in outcomes of diabetes. You may not see all those lines, but the risk of the deaths from cardiovascular disease, in people, this is in people with diabetes, amputations, kidney failure, and also deaths from simply high blood sugar have dropped by about 50%. And the last slide, I think. So what are our conclusions? These are the 3 threats that all of us actually mentioned, not just me. 2 of them, diabetes and hypogonadism, are linked to obesity. We need to prevent obesity, and treatment outcomes can improve, as was mentioned before, with advancement of public health and medical science.
Doctor, all of these health problems that you just mentioned, one is causing the other. The point is, can you help us understand, not to get to all one causing diabetes, 2, et cetera, and so on, what is causing hypogonadism, or what is causing? In order to get, we have the conclusion, but what is the cause so people understand how to prevent this from happening to them?
So as was mentioned before, it is not absolutely clear why
It is not clear.
hypogonadism
But what are
is
some
on
of the
rise.
things that are causing an imbalance or this hypogonadism.
Right. So number one cause, as I was trying to explain, is obesity. And we really need to manage obesity to prevent all of the problems that we discussed today. There is a question also of our lifestyle and some toxins in the environment, a little less understood. I think we will all agree than obesity is, which is well understood. Prevalence of diabetes is increasing. That's causing hypogonadism. So basically, genes and lifestyle, genes we can do little about or maybe nothing at the moment. So we really have to focus on lifestyle.
What should men be aware of in order to have some sort of symptoms to know that it is time to visit an endocrinologist?
Well, I think it may not necessarily be an endocrinologist, but if somebody begins to gain weight in a way that we're talking about men today, cannot really understand, it is time to see a physician. They may end up seeing an endocrinologist, sometimes they don't. If they start having erectile dysfunction at early age.
It's actually a very interesting point that you're bringing up, and I'm glad you're asking this, because we see these patients in our practice all the time. When you see guys that are coming in that are very early and very young age, 25, 30-year-old, that are coming with erectile dysfunction, if you rule out the psychological part of it, if they're under stress, they just took a new job, they have a problem with girlfriend, if you rule those out, one of the first signs of heart attack in young men is erectile dysfunction, because those arteries in the heart that can clog up, it's actually much smaller vessels in the penile tissue. So that's something that you want to remember. So the first sign of early heart attack in young men is sexual dysfunction. Remember that. Going back to the hypogonadism, which is like it's a mouthful word for low testosterone in a way. And if you see that, it's become like a tremendous business in America where billions and billions of dollars are going into testosterone injections. Every man wants to come to our office and they want to be more macho, they want more muscles, they see the picture of the old man in the magazine, they want to look exactly like that. So how do you know that you really have a low testosterone? The first thing you do is you check your blood test before 9 a.m., early in the morning, because testosterone from endocrine has a circadian rhythm, meaning it's high in the morning and it can really go low in the afternoon. Never check your testosterone in the evening. That's the first thing you do. And the next thing is, the easiest way to boost your testosterone is not to go to the doctor and get a testosterone injection, which is what's happening in this country. And billions of dollars has gone into these T centers for what we call a menopause, if it's a term that we're creating on our own. Menopause is someone who is fatigued, he's gaining weight, he's depressed, he doesn't want to go to work, and they think without checking their testosterone level, I'm going to go and get an injection, and they think they wake up. It's a knee-jerk reaction. It's not good medicine. You need to see a doctor before you embark on all these hormones, which will affect your gonads, it will affect your prostate, it will really affect long-term issues, even though short-term they make you look a little bulky. So don't think of what you look like in front of the girlfriend or the wife. Do the right thing for yourself and check yourself and screen yourself.
Dr. Plestis, quick question I didn't ask you. What do you prescribe to men that have cardiovascular disease? What is the prescription? Can it be reversed?
So there are two types of cardiovascular disease. There is an early cardiovascular disease, and there is a more advanced cardiovascular disease. If somebody has early cardiovascular disease, then one has to modify the factors that they affect the cardiovascular disease, like the blood pressure, the diabetes, obesity, smoking. Smoking is very important. If you want to control cardiovascular disease, you have to quit smoking. None of these factors are easy, but they require to pay attention, and they require a commitment for the person itself to modify those factors. Now, if we have more advanced cardiovascular disease, there are medications that people can take, but in addition to the life modification, you have to modify your lifestyle. I agree with David. I think you're absolutely correct that you can't take a medication and expect that suddenly you're going to become 20 years old. It's not happening that way. It requires very hard work, and in addition to that, you can take medications to be able to help you out a little bit, to help a little bit in the management. Statins is a medication that used, by the cardiologist. And of course, you have more advanced disease, that you can treat those diseases with more aggressive methods, meaning either a stent in the heart where you go through the groin, you put a stent to open an artery, or with bypass surgery or valve surgery, which are more aggressive methods. But one has to know that by putting a stent in the heart, you don't cure the problem, you just cure the symptom that you have. And in addition to that, it requires risk factor modification, blood pressure, diabetes, smoking, obesity, and in addition to that, whatever other treatment is necessary for that particular individual.
And you said this before, a pill cannot cure everything.
It cannot.
You have said this before, a pill cannot cure everything. Pharmaceuticals is another topic in itself, but there is a whole list of modifications of lifestyle.
And
in order
people,
to
if
live
I
a
make
healthy
a
life.
statement, people have to be smart. There is no easy solution to the problems. If there was an easy solution, it would be found already. Somebody would be selling it already, but it just doesn't work like that.
That's true.
So it requires a lot of hard work and commitment. As we men, as we grow older, and I take it from myself, I have to work harder to maintain myself healthy compared to what I was in the 40s and 30s. And it's not easy. Not
Thank you,
easy.
Dr. Plessis. We're going to move on to another topic now with Dr. Perry Chalkitis. He has a PhD. He's a dean and professor of biostatistics and social and behavioral health sciences at the School of Public Health at Rutgers University. He is also a faculty member of the Cancer Institute of New Jersey. Dr. Chalkitis' program of research examines intersection between HIV epidemic, drug abuse, and mental health burden, and biological, behavioral, psychosocial, and structural factors that are predispose these overlapping epidemics. He's written many books. His last book, The AIDS Generation, Stories of Survival and Resilience, is a 2014 Lambda Literary Award nominee and recipient of the American Psychological Association Distinguished Book Awards in the LGBT psychology. Dr. Chalkitis, your studies have shown, thank you for joining us, by the way. Your studies have shown that social ecological framework indicates that individual health and health behaviors are influenced by factors that function under multiple levels of their environments. Can you share some knowledge with us and our audience from all your research on the GBM community?
Do I have to press? There we go. Can you hear me? Okay, so first of all, thank you for having me here and for this opportunity to have a conversation with my colleagues. I want to say that first and foremost, I think this conversation about men's health exists not in opposition to conversations about women's health, but as a complement to conversation about women's health. And that holistically, we're dealing with a population of people. Number two, I think that one other point I'd like to make before I dive into your question specifically is that when we talk about men, we're treating them as if they're a monolith. Men are not monolithic. Men come in all shapes and sizes. There are heterosexual men, there are gay men, there are bisexual men, there are genderqueer men, there are transgender men. And these men have very different health needs and health manifestations that I think we have to think about in addressing the health needs of the population at large. So what the challenges are for one segment of the population are not necessarily the challenges that they are for the other segment of the population. For the last 20 years, my work has focused primarily on the health of gay and bisexual men. And at the beginning of my career, my focus was on the HIV epidemic because that was what was devastating the community in the 1980s and 1990s. I would think it would be short-sighted in 2017 to say that HIV defines the totality of gay men's health, but it is still part of gay men's health. In the United States, gay men are 3 to 5% of the population, yet 60% of people living with HIV or AIDS, 60% of new infections. That's what we call in public health a health disparity. If you're an African American or Hispanic gay or bisexual man, your rates are exponentially higher. Why do I point this HIV example out in particular? And I want to talk about some other examples of these issues. It's to get to Yanna's point, which is the following. People don't wake up one day and decide they're going to do bad behavior. They don't decide they're going to be obese, or they're going to smoke, or they're going to become addicted to meth. They are driven to these conditions by social inequities in society. And when we think about the gay and bisexual population, and we think about communities of color in our country, these are the communities that experience racism, discrimination, marginalization at higher rates, which consistently in the literature has been shown to be associated with poorer health outcomes. Minority stress theory, which is one of the theories that we espouse in our own work, which is a theory that's been described very fully by a fellow psychologist named Ilan Meyer, argues that individuals who are members of minority groups experience stressors. So the more minority memberships you have, the more stressors you experience. So if we think about this from an HIV perspective, and we think about why in the United States do white gay men experience HIV less radically than black gay men, it is because white gay men are marginalized because of their sexual identity. Black gay men are marginalized because of their sexual identity and because of their race. And so minority stress theory is one way of sort of conceptualizing the role that social inequities play in driving disease. Another theory that I personally love and has directed our own work at my center for the last 20 years is syndemic theory. And it's been alluded to here. Health problems don't exist in isolation. Where you see mental health issues, you see substance use. Where you see substance use, you see obesity. Where you see obesity, you see cardiovascular disease. And in the literature, this has been defined as a syndemic. And study after study after study after study has shown consistently that populations that experience marginalization and psychosocial burdens at higher rates not only have a higher rate of syndemic, but these health conditions fuel and exponentially make each other worse. And I think this is sort of the perspective that we saw, besides the biomedical perspective that my colleagues have done a beautiful job expressing, to think about the health of men in general. I want to just say a couple more things related to some of the issues that came up today. The issue of masculinity that often defines the lives of men is probably best understood as hypermasculinity. Masculine conceptions are completely a natural thing for men to experience. Hypermasculine perceptions, having a body of a certain type, acting in a sexual way, being aggressive, those conceptions of masculinity are the ones that deteriorate health. So when we think about the lives of gay and bisexual men in the United States, I want us to expand our thinking and to think about the lives of gay and bisexual men in the world. We have to expand our thinking beyond just HIV. Gay and bisexual men experience heart disease at higher rates than straight men do. Gay and bisexual men have experienced HPV, and I'll get to this point in a second, and the manifestations of HPV at higher rates. They experience depression and suicide and substance use and anorexia and body dysmorphia at higher rates than their heterosexual counterparts. Why is that? Because of the social conditions that gay and bisexual men are raised in. Look, we think that in the United States everything is wonderful in 2017 if you're a gay man. It's hardly the truth. A young person who's struggling with their sexuality and trying to find their place in the world turns on the TVs and hears tirades all the time about what it means to be a member of a sexual minority. I want to just highlight one more point here, which is the HPV point, because I think it's not come up at all. We know anal cancer is not very common in the population. It is 2 per 100,000 is the rate of anal cancer. In fact, nobody had heard of anal cancer, probably. Most people in this room and most people in this country had not heard of anal cancer until Farrah Fawcett became diagnosed and eventually died. If you are a gay man and you are an HIV negative gay man, you are 40 times more likely to have anal cancer. You are 80 times more likely to have anal cancer if you are an HIV positive gay man. So this is another manifestation of a health disparity that is very particular to a population. And you know, we talked about pap smears here, you know, a little while ago. Gay men have pap smears too. And so if you're a gay man listening to this and you have anal intercourse and you are not vaccinated for HPV, please go have a pap smear because you can prevent this cancer from affecting your life.
Thank you very much. Dr. Halkitis, what type of a message would you like to give our audience based on some risk factors and some prevention that men can actually be more aware of? What is your checklist?
Yeah, so I would say, you know, the challenge for, I think that, look, I feel like the challenge for men in general is, you know, engagement with care. And hypermasculine conceptions are definitely interfere with that. I think, in fact, probably gay men are better at connecting with care than heterosexual men, just because the population has been forced to because of the HIV epidemic, right? But still, I think I'm going to point it outward and say the following. I think it's not about the person necessarily, but we have to think about, as a society, how do we deliver care to men in a way that's accessible to them? Men in our studies have consistently told us that when they have the sniffles, they go to one doctor, and when they have a discharge from their penis, they go to another doctor. Why is that? they feel judged about their behavior. And so I'm challenging all of us who provide, who do research and provide service to the population of men to think about providing service in a way that is non-judgmental and encompassing. And quite frankly, if we can get men to do one checkup once a year, that would be a step in the right direction.
Bravo. Thank you. Thank you so much. On all, there's a plethora of information that I'm sure we're not going to be able to cover today, and it's very brief. But I'd like to pass it on to Ryan Turner, who's an experienced cardiac dietitian, having worked at one of the nation's leading centers for cardiology and heart surgery. He's worked closely with interdisciplinary healthcare teams to develop dietary strategies to support cardiovascular disease, surgical recovery, diabetes, kidney disease, cancer, malnutrition, obesity, weight loss, and GI disorders. Ryan holds one of the most prestigious sports nutrition certifications in the United States. Ryan, what is happening? First of all, what is happening to the American food chain? That's another topic in itself. But what are men eating that's affecting their health? You've heard all of these diseases today, and you deal with them with your patients. Tell us a little bit about what are they doing wrong? What are we doing wrong?
I think it's a good question. So thanks for presenting that, and thanks for having me here, Yanna and Susanna. When approached with the question of what do we eat to be healthy, it's a very loaded question. People do walk in our office all the time. I'll get a patient and they want a silver bullet. They want something quick. And that's why a lot of people will jump to a medication very quickly, because I think it was said, it takes a lot of hard work to make a difference in your lifestyle with diet, right? So it does take hard work. No one's gonna lie to you, and I'm not gonna lie to you either. And it should take hard work, because the success there is gonna be that much better. But when approached with the question of how should someone eat for, I think longevity is definitely how it's really presented to me sometimes. I'm going to first be able to look at just what it is that is going to be affecting men most of the time, right? So, just according to the CDC, we were going to see that heart disease and cancer are the two leading causes of death for men, and that's a large portion of it, right? As we kind of get to some of the other leading causes, it's a smaller percentage for sure. Okay, so that is where I would approach that, and I definitely say it's the heart disease and cancer. So the answer isn't easy still. We want to understand, well, what are we going to do with those? So approaching something like, okay, how can we prevent heart disease? That's what we want. We want prevention, right? We don't want to be coming at it in a reactive way. Proactivity is the best way to take care of it, right? So, and even if we break it down by age group as well, we will still see that it's heart disease and cancer most of the time, and even by race. With cancer deaths as well, in 2017, it's usually lung, prostate, and it's going to be colorectal cancer. So we can look at studies, and as a dietitian, that's what we really want to go based off of. We're not going to be going off the trendy type of diets. We're not going to be going off the fad top 10 Yahoo list for the most healthy foods, which I think is the tough thing in this society. We get a lot of fad diets. We get the things that are going to be buzzwords, right? And we have a lot of doctors on TV that are going to push certain things to make money. There's profit to be made in nutrition. It's going to take hard work, and it's not going to be something that we have to make more difficult. We want to look at exactly what it is that we can do to treat what those main problems are. So when we look at something like heart disease, and let me just stop here and say that when we look at heart disease and we look at diet and we look at something that is going to be based, again, in research, we want to get someone's blood work. So I think if I'm telling anybody today, yes, you should know your cholesterol level. It doesn't stop there, though. And I'm sure you guys can let me know that what we want to break it down to is your triglyceride level, your full lipid profile, your HDL, your LDL. And now what's becoming more popular is actually your particle size, right? So without getting too deep within there, yes, there's a genetic component for sure. There's familial hyperlipidemia, which that's something that we want to be able to catch in younger patients. If we find that maybe your parents or it's within your gene pool, right? Well, we can take some younger people and start to affect their diet sooner. And that can really help with preventing heart disease. But coming back to the blood work, we as dietitians want to work very closely with cardiologists, right? Just with primary care physicians. Bring your blood work to a dietitian so we can break it down for you. If your triglycerides are high, that tells us one thing, right? The leading driver of something like high cholesterol is really a mismanagement of carbohydrate in the diet. Also, a driver is going to be alcohol. We have to look into those things.
It's important that you're saying this because people believe it's fat.
They always do, and I think that's something where, I'm hoping that everyone now knows. People walk in my office all the time, they say, ooh, that food's high in cholesterol. Why would you tell me to eat that? Eggs, lobster, shrimp, right? They always look at those, and I always tell people, do not listen to anyone who's telling you that if that food has cholesterol, that's driving your cholesterol up. Please, 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 if you hear that, I would suggest finding someone new to speak with, okay? It's just not scientifically accurate. And I would say it's not scientifically accurate anymore. So at one point we did believe it, but now we want to make sure that we're getting away from that. But just back to the labs, we're going to look at the triglycerides and the LDL, the HDL, and the particle size, which we can't change your particle size. That is heavily genetic, right? But the diet can change everything else. And if you give a dietitian your labs, let's definitely work with that. Now, we also want to be looking at research to know what are the trends within the food that we see that can limit, that can prevent the incidences of heart disease. So when we start seeing in someone's diet the amount of fiber come up, right? We want men to be getting about 38 grams of fiber a day. If we start to see that drop, we just have a higher incidence of risk. That's all it really is, right? So what we want to find is people really getting in more fiber in their diet. That's going to come from non-starchy vegetables. It's going to come from fruit. And depending on what group you look at, say the American Heart Association, they're going to tell you 5 to 7 servings of fruit and vegetable a day, okay? Well, that might not mean much to you, right? But we have to figure out, work with someone that can tell you, well, this is what 5 to 7 servings is, right? Not to make this sound too juvenile, but a cup is like a fist, right? So I can tell you, okay, you want 5 to 7 fists of vegetables and fruit, and we can work with you and try and find that. But we also want to make sure that if you're choosing a vegetable or a fruit that might not be very high in fiber, we don't want the mushrooms and the onions, right? Maybe it's the broccoli and the Brussels sprouts and the asparagus, right? When we also talk about fiber, it comes down to the fact that fiber is not just this absolute thing, right? Fiber breaks down to two different things. It's basically soluble fiber and insoluble fiber, right? So if we keep pushing the higher fiber starches that might have a higher amount of insoluble fiber, well, you might have great bowel movements, right, very quickly, but it's the soluble fiber, the type of fibers that are going to be found within certain foods that are going to absorb water, become more gel-like, right, slow down digestion, keep you fuller longer, work on obesity. And as it moves through your intestines, right, it starts to actually hold on to the sugars within food, the natural sugars, right? I'm not talking about added sugars, but the natural sugars, the carbohydrates in food. So it's not hitting the walls of your intestine and shooting into your bloodstream. As it moves further along, that soluble fiber starts to grab onto cholesterol, really in the form of bile, and it pulls it out of the body, and that can lower a lot of those cholesterol levels. So we want to make sure that when someone says eat your fruits and vegetables, that we're talking about fiber, but the right kinds of fiber. And it's a very loaded thing, so we have to kind of break that down. I think with heart disease too, I think we always get the cut out sodium. Don't be eating salt. Reduce your salt. Cut, right? But the problem is we come from this area of restriction, right? And then it's just like, why do we want to fix our diet? I'm just going to go ahead and keep it easy, whatever someone gives me, right? And then all of a sudden you're eating anything out of a package, whatever that line cook deems appropriate for you for that meal, right? But there's one thing we're missing, right? Sodium is associated with this issue, right? But potassium is the larger problem. We aren't eating enough potassium that can negate the effect of sodium. What has potassium in it? Your vegetables, your fruits, right? Come back to fiber. Get enough fiber. You're going to get enough potassium, right? That's going to be important. We want to manage your blood sugar. So we're going to be looking at the timing of meals. We do want to look at why are we going to feed you at the timing someone tells you? Well, we want to promote lean muscle, right? Lean muscle can help you control blood sugar. Lean muscle can help you feel more energized. We want that. Lean muscle can help oxidize body fat, all of that, right? How do you feed lean muscle? Well, timing's important. Your muscle wants to be eating about every 3 to 4 hours, right? That helps you control blood sugar. When you're eating, what are you eating, right? Is it just going to be high starch kind of stuff? Maybe my athletes, that's a good thing. But when it comes to what you want to eat when you're sitting behind a desk, when you're sitting behind a computer, you want to be eating higher protein, higher fiber foods. And if you are more active, I am going to give you more carbohydrate, right? That's going to be your prescriptive diet, right?
Ryan, real quick.
Yeah.
I still like my old.
In general,
And no one's telling
what-
you
and
not
I
to
asked-
have oatmeal.
and I asked this to Dr. Paresky, what is the human body designed to eat? What should the human body be eliminating, and what should it be adding in today's times?
What should we be eliminating, right? So again, I really need to correct that, right? The answer is not restriction. The answer is, what does your body require? Come from that place first, and then let's make sure that we're looking at it. So when we really look at that, what we want to be doing is, again, we're going to be coming to getting enough protein in. I don't care if you're vegetarian, vegan, or you're eating a meat diet, right? It's still going to come down to protein. We have to maintain that muscle mass. That's the number one thing we want to do. And then we do want to make sure we're giving you enough carbohydrate. Don't be afraid of starches or carbs, right? That's really great stuff. Some people, we're not all this absolute person, right? I think we've mentioned that. Everyone is going to require a different amount of energy, different amount of carb, different amount of protein. Come find a dietitian. We can help you with that kind of thing.
Can I ask a question for
Yes,
Ryan?
of course.
I make it very easy for my patients, and you tell me if I'm telling them the answer to your question. I tell them, like, cut out anything that's like a white powder in your life. Get rid of salt, because we're getting a lot of salt we're getting about 3,500 grams of salt. It's all over. So not to eliminate it, but to reduce it, because you're already getting enough. Get rid of your sugar, get rid of white flour, and get rid of cocaine. 4 white powders can make you healthy again. Yes? Am I doing it?
I think that that's something that's very general, and that's good. I think we can make things easier. I think it can be more specific, right? When we're really looking at the things that are truly gonna help, we're wanting to make sure that we are just going to be promoting that fiber, promoting potassium. We want to promote omega-3 foods, right? We have an issue in our food system right now where we have a ton of omega-6, right? The more pro-inflammatory kind of foods that are going to be coming from a lot of the more animal, the more vegetable fed, corn-fed type of diets, right? So we want to make sure we're at grass-fed as best as we can. It's just associated with higher omega-3, which is associated with less inflammation in the body. Just promote less carbohydrates and sugars. Promote hydration, right, from non-sugary beverages. We also want to make sure that we give appropriate recommendation around alcohol. 2 drinks per day for men can definitely be something that's associated with help, but don't promote it throughout each day.
And start walking.
And the thing is we want to look at is leanness. Leanness is the number one thing, whether you look at the Okinawa study, whether you look at the AARP studies, whether you're looking at the Seventh-day Adventists. The one overlapping thing is leanness, a BMI of about 23, and the BMI is a tool. Don't judge yourself based on your BMI, but the leanness is what we want to be looking for. And move, right? What I will tell you is this, that the last thing, with just physical activity, 4 days per week, 45 to 60 minutes of a higher heart rate, about 80% of your max heart rate, that is what will drive down your triglycerides. Okay?
If you have a serious job, 3 days a week will do it.
Even 2, ladies and gentlemen, at least
More than
do,
nothing, yes.
do something once or twice a week. Thank you so much, Ryan. And in closing, we're going to pass on to Doctor of Chiropractic, it's not medicine, is it?
No, chiropractic.
It's chiropractic. Doctor of Chiropractic, Christopher Mango. I'm sure you're treating many patients with stress-related issues. In a quick nutshell, can you please enlighten us about how stress affects the body? Because you're seeing that with your patients. And I know we wish we had more time, but we do not. But real quick, if you can just give us a few pointers on what's happening to the body when we have stress.
Yeah, so there's about 3 common stresses in the body that almost always will lead to breakdown if left unchecked. And I want to quickly talk about how to identify them, how to fix them. As a chiropractor, I deal with pain all the time. But what's interesting over the last 14 years is realize that 8 out of 10 patients that were coming into our office, they didn't have a reason for having the pain. They didn't fall, they weren't playing basketball, they just had pain and they didn't know why. And we started to isolate 3 things, 3 types of stresses. Stress is kind of an umbrella term, but the 3 stress we're going to talk about are diet, adrenal, and then sitting. 3 things that almost everybody does, has a little effect to. Diet, Ryan just did a great job. I'm a big whole foods guy too, real food. People that come in because of diet stress, they're inflamed. They have pain everywhere. They can't think right, they have brain fog, they have elbow pain, their back hurts, erectile dysfunction, everything. With those guys, you got to work on the diet. You got to get rid of the inflammatory foods, processed carbohydrates, sugar, dairy. Those are the big 3 that we work with. People go off of it for 30 days. I always say it's kind of like you're like a juice box. It's if like you pop a hole, blow up. You're just a little bit puffy all over. It's amazing what 30 days does just off of that. You know, get to the grocery store, just eat on the outside, don't go anywhere in the middle, and spend your money on the clean meats like he was talking about, and wild-caught fish and all that kind of stuff. Supplements, also with diet. If you live in New York, I don't like giving a lot of supplements, but if you live in New York, there's two that are tough to do without, probiotics and D3. You don't really get enough sun. Unless you're outside for 20 or 30 minutes a day, your D3 levels are probably going to be low. It's a good thing to supplement with even through the summer. And then probiotics, from your mouth to your anus and in between. There's a limited amount of space. There's good and bad bacteria. Fermented food, dairy, those are the two big sources of that. Dairy in New York, pasteurized and monogized, so everything's irradiated. They put stuff in, but it's not as much as they killed off. The new stuff with probiotics, which is good, people are taking them, but people aren't really diversifying. So the new stuff now is like our vegetable crisper is filled with it. Use different probiotic from a different manufacturer. Everybody has their own strands. It's good to get diversity in there. That's diet. Adrenal.
Close it off with adrenal.
Adrenal. So we're sort of stuck in this constant fight or flight. We have relationship stress. People in the UN have been dealing with the world's problems, but now it's all of us are. This constant news, social media. We're always stuck in this lions in the room. We got to get out, and we can't turn it off. There's blue light from the lights above, from our screens, always. So we work with people with adrenal stress. This is where some of those traditional healing methods work great. Acupuncture, meditation, chiropractic, Pilates, exercise. Anytime you do something and you feel that weight off your shoulders, you can breathe easy. You've kind of stopped that cycle of that constant overload of there's a lion in the room, I gotta get out. That leads into a lot of people manufacture stress because we were talking about we don't really go hungry anymore. There isn't real true danger anymore. So we make a lot of fake stress. And that gets into talking, people journaling, all that kind of stuff. I know we're running out of time. Herbs for stress. There's a class of herbs called adaptogens. Totally safe. There's about 10 of them. We use about 5 or 6 in our practice. A nursing mother can use them. Reishi, ashwagandha, holy basil, eleutherio, rhodiola, those are good ones. They work great. They're like food for the adrenals. They help you adapt. They fall in that really safe family. 2 weeks, you should notice a huge change. If you don't notice a huge change in 2 weeks, try another one. If you find one that works, go with it for 2 or 3 months and you can notice a change. And there's just one other stress is sitting. Do we have time?
Yeah, just 1 minute.
1 minute.
Yes,
Okay.
sir. Absolutely. It's all important information. We just don't have time. Don't get
I wanted to be the first person in the UN ever to do this. So I was at a 2-year-old's birthday party the other day, and Elmo was blowing up balloons, and it became a really good model of seeing how bad bending and sitting all day can be for your lower back. A lot of times people think their lower back is an issue, and it's usually not. Your lower back is stretched. Your lower back muscles get very brittle. Your lower muscles don't have a lot of oxygen or blood to it because when you bend a balloon, if I had a pin, what's going to pop easier, that end or that end? It's going to be that end, and that's the end that we sit with if you're sitting. So a lot of times people will go play a sport or they'll go to do yoga or something like that, and they'll try to stretch their back. That's not always the answer. The answer is to look opposites. So look at your hip flexors, look at your hip mobility, all that kind of stuff, which is there's a lot of tools. I'm gonna be here till 4 if anybody has anything specific. I know this is getting live broadcast, and I can go over that in detail.
Mushrooms are the answer?
What kind of mushrooms, Greg? Okay. Ladies and gentlemen, we'd like to thank you so much for being here. I'd like to thank our distinguished panel for all their time, their precious time that they took away from their practice to come here today, and their patience to give this information to our audience and to share all this knowledge. And at the end of the day, it all comes down to one thing. We all have predispositions. We have to do things to prevent these diseases, and we have to be careful of how and we're living our lifestyle, what we're eating, how we're thinking, and if we're exercising. Mind, body, and soul, as the ancient Greeks used to say, are one, and when one breaks down, so does the other. It all has an effect. Thank you for being here with us today. Thank you for being here to discuss these issues that men are at risk for and how we can help prevent and manage these risks during their lifetime. While these reasons are due to biological factors, men's view and attention to their health also plays a major factor in prevention. So men simply put their health last. So we want to change that here. That's what the Salus Wellness Network is doing. And thanks to the United Nations Recreational Staff Council, they've given us the opportunity to present all this information to you today. Hope today's discussion will increase men's attention towards preventive measures and sustaining a healthy life through the methods discussed today. Thank you so very much.
Thank you.
And also, please, you're welcome to Salus anytime. Please register. We have valuable information. Everything is going to be broadcasted, and everything, like us on Facebook. We are posting everything we're doing, and we have also the biographies of the doctors and also the addresses. And if you'd like to make an appointment for your health, you're welcome. And please come to the lobby at the UN right now in the Secretariat. We're going to be there till 3:30. We have the tables all day. Please come and have a PSA screening. Thank you once again to everybody. Thank you, doctors. Thank you, friends. Thank you, Yanna. Thank you, members. God bless. Ciao.